Good evening and welcome to the Health, Social, Educational, and Environmental Committee meeting this evening for August the 20th, 2024. Let's please rise for the Pledge of Allegiance. Legislator Goldman, would you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, roll call please.
Legislator Crowley.
Present.
Legislator Goldman.
Present.
Chairwoman Sage.
Present. Okay, this evening I asked our Commissioner of
Number
Social
3.
Services, Sarah
The
Servideo.
minutes.
Oh, we have to do the minutes first. Let me do that. Number 3, I'll make a motion to accept the minutes.
Second.
All in favor?
Aye.
Thank you and welcome to the Health Committee meeting. I asked our Commissioner of Social Services, Sarah Servideo, to give us a brief update on plans for the Stabilization Center. And I will
Hi,
give you the floor. How are you?
good, thank you. So there's not much that I can report. It is in the hands of engineers at this point, but I can say that People USA, myself, the County Executive's Office has weekly scheduled meetings every Thursday afternoon for updates and to discuss what's going on. Hopefully we'll have contracts in hand September-ish, but right now, unfortunately, there hasn't been a lease signed. We're still working with,
The location? Is
they
that what
are
it is?
still working with the engineers. So
Oh,
we can't
okay.
move. There's some structural changes that need to be made that they can't move forward with until everyone is in agreement.
Okay, so you foresee the possibility of September, they'll be making changes or sign a lease or?
Yeah, we want them to sign a lease because then we can start contributing financially. Obviously, without a contract, we're not doing that yet, so.
Okay. All right. And that's kind of a,
Yeah, I know, I wish I had more to give you. I can say we talk about it weekly, so we're on top of it, and we're motivated still. It's just a lot of people involved.
okay. Anyone on the committee have any further questions? Any other legislators want to ask a question? Legislator Montgomery.
Can you remind me, this is ARPA funding or it's opioid settlement funding or
ARPA.
both? ARPA. So we don't have a lease by when? We need a lease by the end of the
Has to
year.
be spent 2024, doesn't it?
2020, by the end of
We have
I know.
to spend the money by the end of December. Okay, never mind.
Yeah. Legislator Nasarino.
We've been talking about this for a very, very long time, and it's really a crucial project, and it really is necessary. I don't know what defines the engineering structural problems that's holding up the works. We were very optimistic a couple of months back with this site. My question is, once everyone is in agreement and a lease can be drawn, how long thereafter will it take for this project to come to fruition?
So it's a septic issue. So the Department of Health is also involved.
Mhm.
Once all of that is taken care of, I guess, then it has to go in front of the planning board.
Oh my goodness.
Legislator Crowley.
Do we have a secondary location picked out just in case we are running into a time constraint where we may have to go somewhere else so we can spend that funding for the stabilization center?
So that conversation has started.
Okay.
So upsetting, because if we don't get these funds in place by the end of 2024, don't we lose the ARPA funds and then we'll transfer them to something else? And then I'm afraid that this stabilization center won't get off the ground. It's getting to the wire. Any other legislators have any? Legislator Bianchi.
I know you don't want to disclose the location, but is this a location that we've discussed in the past?
Yes. Yeah, it's still that location.
I understand, I thought that would have had sewer right there.
Those are questions I can't answer, I'm
Okay.
sorry.
Legislator Nasarino.
Given the fact that there's unforeseen circumstance that dictate when this will come to fruition or leases will be signed, we may need to explore the possibility of reallocating those ARPA funds and using those funds for a county project and then paying ourselves back, so to speak, as we have done with some recent projects.
Backfilling. That would have to be done. We have to
Kind of
explore what
flip-flop the money,
the timeline of that is.
so we don't
with-
lose the money.
With our Commissioner of
So maybe
Finance,
that's
I
a point
think.
of discussion that can be done just as a safeguard, because we are really have to commit by December 31st.
Right.
And you don't want to lose that money, nor do you want to, should anything else occur. Because by the time the lease gets signed, by the time it goes to the planning board, and by the time all the i's are dotted and the t's are crossed, it's going to be several months. I'm disappointed to hear that, because it is so necessary for especially, adolescents and kids who need it, that have been gone to Westchester or Dutchess in lieu of having someplace in Putnam to go, and it's still a long way off. But that has nothing to do with
Yeah.
you, it's out of your control, it's just, I wish it was sooner, that's all.
Maybe that's a discussion that we have with our Commissioner of Finance to see what's the drop dead date on this and how do we reassign these funds.
Just have to have some creative financing done.
Yeah. Legislator Montgomery,
If you want.
go ahead, Legislator.
Is it realistically feasible at this point, though, with, if the issue gets worked out and the timeline with the planning board, is it feasible to do it at all realistically? I mean, I'm asking an honest question.
I don't know.
Okay.
I
So-
would imagine if it wasn't, somebody would have said something to me by now.
And the
Planning
town,
boards can take 6 months.
yeah,
Yeah,
that's what
it's
I'm
a
concerned
long
about. So
process.
that backup is something that you're in communication with, and it's a feasible backup, or it's just a hypothetical?
That conversation has just started. We have no secondary location.
Oh,
The
so
conversation
there's,
just started
it's
that we need to
just,
start looking for one.
oh, okay.
Yeah.
Gotcha.
Yeah,
That's
I'd
it.
go back to my comments when we allocated these funds, which I think I approved and voted for, but my point was there is a stabilization center in Poughkeepsie, maybe 45-minute ride from here if we had just invested in transportation for folks. Yes, there's a lot of people in need, not so many that we can't manage transporting them to a location in Poughkeepsie. Certainly, the folks that live in my district would probably go to Poughkeepsie anyway. I just think, I agree with Legislator Nasarino that we need to reallocate these funds quickly to another county project. I hope the county project does involve social services and mental health and addressing this crisis along with the many other mental health crises we have, including suicide. And we've heard from social services, we've heard from probation, we've heard from the DA's office, we've heard from the health department who are down 3 nurses that, so let's build a stabilization center and we don't have anybody to fill it because there's no psychiatrist, there's no therapist, and there's no nurses. So what are we doing?
Well, the stabilization
Well,
center is
it's
being
being
run
run
by
by
a
someone
not-for-profit.
else. Yeah.
So they have their staffing and they hire their employees, and that's where the contract comes in.
So, but it would be in our best interest to understand even they don't have the staff. None of these agencies have staff, believe me, I know firsthand.
I haven't been told that they don't have the staff for it, but I also haven't asked.
One psychiatrist for an entire hospital. That's what I've witnessed.
Well, right now, we're concerned about the stabilization center and the timeline of that. So, okay. One more question?
Yeah, just for a constituency standpoint, we have Poughkeepsie obviously to use, and they were building a secondary location aside from this one that we had planned. Do we know if that one is moving ahead and moving forward?
Westchester and
to-
Ulster.
So do we know where they are? So if constituents needed to go there, would that be until we can get ourselves grounded and figure out another resolution? Do we have the stage where they are in their?
They are not at the stage where we are right now. So
They're ahead
the
of us.
Westchester location, I'm told, is gonna be southern,
Okay.
Mount Vernon, Yonkers
Okay.
area.
Okay.
So I don't know. The Ulster location I will get for
even
you
further.
if it's been identified yet. I don't know, last I heard it wasn't,
I was
but
looking more for Westchester to see
Yeah.
if somewhere, it could meet somewhere in the middle for
Yeah.
constituents if they needed it, but I agree with Legislator Nasarino as well about, backfilling and making sure it's taken care of.
Okay.
Thank you.
Moving on to agenda item number 5. Commissioner Sergio, this is for an approval for budgetary amendment for social services to purchase items needed by the co-response team's crisis intervention specialists using opioid abatement funds.
So we were hoping to utilize some of the grant to purchase the bulletproof vest and computer and desk. Unfortunately, it was not approved as an expense, so we need to utilize some of the abatement funds for the purchases.
So this is from grant funding that's going into purchase furniture, furnishings, computer equipment, other
No,
equipment.
unfortunately, the grant didn't approve
Oh, it
the
didn't approve
purchases.
that.
That's why we need to pull some of the abatement funds.
It's the opioid abatement funds as opposed to the grant
Yes.
that we're using.
Right. Okay, and the amount is $4,300.
About $4,300, yeah. The vest is quite expensive, so it's coming in at $1,500 was the quote, so.
Anyone on the committee have any questions? Any other legislators have any questions? Any public? Of course, I keep forgetting to ask the public, we all have the opportunity to ask questions as well. Oh, I'm sorry, I didn't see your hand over there. Go ahead, Legislator Crowley.
The other vest is for the other person when going into,
The mental health worker.
yeah.
Yes.
Okay, that's what I thought.
Yeah.
I just want to.
She's been just borrowing one from the sheriff's office right now.
So she hasn't been fitted, okay.
Exactly.
And she's wonderful, so thank you.
Okay, if there's no further questions, I will make a motion to approve this budgetary amendment 24A076 in the amount of $4,300.
I'll second it.
All in favor?
Aye.
Aye, thank you. Okay, and moving along to agenda item number 6 is an approval for a budgetary amendment for social services again. Use funds from vacant personnel line for equipment and supplies. Did you want to embellish
So
on this one?
we've had a vacant forensic interviewer position for, since the previous worker relocated. It is a grant-funded position. Because it's been vacant, we do need to reallocate and spend the money elsewhere until we're able to hire in the position. We are working with Director Eldridge to reclassify the forensic interviewer position. So we will be coming to personnel hopefully next month to have that conversation. But until that happens, we need to take a look at the grant, and we're using a lot of it for training and education. Also going to be replacing, a desk or two, and some supplies.
It's pretty straightforward. Does
Yeah.
anyone have any questions regarding the use of these funds? There's zero fiscal impact, and it's the amount of $59,214.
I just have a comment,
Sure.
just seeing these two allocations for social services and the crisis intervention team and, for the forensic interviewer, and it always seems like it's because of a vacant position, and it's like hard to see that. It's really hard for me to see that. So I worry about the department and having enough staff and the people that you need, because as we know, over and over again, we've heard the mental health crisis is just getting worse. We've seen it firsthand. This week, you saw a devastating email about, deaths in Putnam County. We had another suicide in my district. It's not getting any easier. I worry about you, I worry about your department, you don't have enough staff. What do you need?
How much time do you have?
I know you need furniture.
How much time
I guess
do you
we'll talk
have?
about it at personnel, but
I think
it's just
that,
like it needs to
yeah.
be said over and over again.
I
Yeah.
think that we will absolutely come back, and I was speaking to Legislator Sage earlier about maybe coming back next month and talking about that, because with the creation of the co-responder team, I've talked about how we're identifying more people that need help and assistance. So we're averaging about 12 a day, and the CRT just can't keep up. So that is something that, we're identifying people, what do we do with them then? So it's twofold. We need help on the front end, but we also need help on the back end. Last week was a very rough week for Putnam County. We had 2 of our residents die by suicide. We had a significant attempt last week, and this is happening more frequently. So we really are doing the best we can, and with identifying the issues now we have to figure out how we're gonna prevent it from happening.
And this is something that we spoke about earlier that we're gonna attempt to go through and talk about at the next health committee meeting next month.
Yeah.
Talk about caseload, talk about the mental health crisis here in Putnam County, and how we go from here.
I just think it's kind of a sidebar to it, but implementing some sort of de-escalation and mental health and wellness training for our first responders, our health department, who are seeing things like this on the floor, different departments that we have, I think is really necessary for your own mental health as well.
Yeah.
That we need to take seriously.
I just, if I can,
Commissioner Montgomery.
while we're on it, and this will come up again in physical when we talk about New York swims, but, I just have to thank Sarah and her staff for responding. There was a drowning incident also this past month, and the state parks called me and said, do you have a, what's the response team called?
Psychological response.
Yeah, and we don't. So Sarah and her team, it's something Westchester has, it's something Dutchess has. This happened in Putnam County. We didn't have a response team. These adolescent lifeguards witnessed this. The kids on the beach witnessed this. We needed somebody there to debrief, and Sarah showed up with her team. So thank you.
Thank you, Sarah. Yeah.
So is that the only one?
That was it. That's it. So I'm gonna, does anyone have any other questions regarding this use of funds from the grant? Excuse me, that was vacant personnel lines, going for equipment and supplies. So I will make a motion to approve budgetary amendment 24A-075 for social services in the amount of $59,214. Ms. Gunpack, may I have a second?
Second.
All in favor?
Aye.
Thank you. Thank you so much. Okay, moving on to agenda item number 7 is other business. We don't have any other business before us this evening, so I'll make a motion to adjourn. All in favor?
Aye.
Thank you.